I think it's important that our clinicians also have a greater sense of awareness of what their practice might look like by the numbers. Because often when they see the numbers, they might have their own motivation to act or to want to monitor or to dig in and get curious. And I think that is just a healthy part of having data at your fingertips.
Welcome to Leading Quality, the podcast spotlighting the people moving healthcare forward from the front lines to the C-suite. I'm your host, Jason Meadows. Today's guest is Gayle Grout, Executive Director of the Health Data Coalition of British Columbia, a physician-led, not-for-profit organization that supports primary care clinicians with meaningful practice-level and population-level insights drawn from electronic medical record data. Gayle came into healthcare through technology and consulting, spending early years at Deloitte Consulting, working in IT strategy and implementation. She later joined one of British Columbia's early electronic medical record companies, where she worked closely with family physicians and learned firsthand how technology, workflow, and measurement shape day-to-day clinical practice. Long before data-driven care became a buzzword, she was already asking a harder question. How do we measure quality in a way that actually helps clinicians care for patients? In her current role at HDC, Gayle leads work that aggregates EMR data across multiple systems to give clinicians a clearer picture of their practice, while deliberately building trust, psychological safety, and curiosity around data use. This conversation explores a central tension in modern healthcare: how to use measurement to support learning and reflection rather than judgment or surveillance, and how data can reconnect clinicians to purpose rather than contribute to burnout. Gayle Grout, welcome to the show.
Thank you so much for having me. It is so nice to connect with you, especially because we met at IHI so many years ago.
You as well. I've been excited for this conversation for a while, and I'd like you to give me and to give our audience a bit of an overview of your career timeline up until now, just to set the stage and what brings you to Health Data Coalition at this point in your career.
Yeah, you bet. I came as a technology enthusiast. My previous life, I feel like I came from the consulting world. Worked for Deloitte Consulting for a number of years in IT strategy and implementation. And for personal reasons, ended up leaving the firm and moving back to BC to be closer to family. And through that, I stumbled upon a great little startup company that was emerging kind of electronic medical records back in 2007. I never really worked in the healthcare sphere before, but got to learn a lot. And I always say that I'm so very grateful for the family physicians that took the time to explain the industry to me. So fast forward, I mean, I think there's always been an interest to be able to support primary care physicians since that, that first kind of interaction with technology and primary care. And so I find myself now at the HDC, or the Health Data Coalition. And this is, I think, what I was supposed to do. Even back then, back in 2007, I was asking about metrics and, how do we measure good quality care. I was even asking those questions back then. And I love that I get the opportunity to kind of try and help shape some of that for our province now.
I think this is a unique structure that even within Canada and certainly outside of Canada, others wouldn't have any kind of frame of reference for understanding. So can you tell me a little bit about what Health Data Coalition is, kind of how it's structured and funded, and then we'll go back into the data stuff?
Yeah, you bet. The Health Data Coalition is a physician-led organization where its founders, back in 2007, there are a number of innovative clinicians that said, once we can, digitize this information, imagine what it can do, for the community and for our province. And they had a big vision, even back then when they were just starting to implement and adopt, EMRs into their own practices. And so we are a not-for-profit organization that is funded by the Family Practice Services Committee, or the FPSC, here in BC, which is a joint collaborative between Doctors of BC and the Ministry of Health. So we're very fortunate to be at this collaborative table to be able to provide this type of service to our primary care clinicians. I think it's important, though, that we are an independent not-for-profit for a number of reasons. And I think part of it is we are truly trying to support our providers and our EMR partners. They know that our intentions are for the benefit to support the provider to provide great care to patients. So we're kind of like, I always joke, I'm like, we're kind of like Switzerland, because the EMR vendors, while they are in competition with each other for market share, they are very much so, they understand what we're trying to do, and they are very much so supportive of what our goals and our purpose. So they really want to align and help. And I think that's something super that makes us a little bit special. So we are an organization that, again, lots of primary care involvement. We also have what we call our Clinical Data Stewardship Committee. This is a very important in terms of data stewardship. They review the measures that we create, the definitions that are created, because at the end of it, we always want to make sure that it is for use of the provider. It is understood. It gives that feedback back to the provider for their practice. And that's, I think, a really important piece. Now we're playing, we're testing some other kind of, measurement for community and for population health. But by and large, it is super important to the organization that we create measures that are meaningful and purposeful for primary care clinicians.
Yeah. Okay.
Can I add on another comment in terms
Sure.
that could tag on to the Clinical Data Stewardship Committee? Because I think it's important that, again, that group also, as they're creating definitions for, our measures, they're always taking in kind of, different guidelines. Here in BC, we have the Guidelines and Protocol Committee, otherwise known as GPAC. And a lot of that is threaded into a lot of our work. I also kind of wanted to mention as well, we're so super lucky to work with partners like UBC CPD, continuing professional development, because we get to create measures that align to their education. And so, how wonderful is it to be able to learn something new, reflect upon your practice, see the quantitative statistics in your practice, and potentially be motivated to, apply that new knowledge into your own clinical practice that you control, right? It's one of those neat things where I just think that, it's easier to kind of reduce that no-do gap.
Maybe you can tell me a little more first about what experiences in your career up until now kind of shaped the way you think about data, and what drew you, I guess, to working in something like the Health Data Coalition.
As a consultant, there was always measurement, because you're constantly trying to figure out what the baseline is, and then to be able to demonstrate to your client the change, the impact. So that's always been part of the work that I had followed and had trained before. And so it felt very, I think, normal to bring that type of mindset into different industry. I think about actually one of the last projects I worked on. We saved the organization just under $1 million on the first morning that we went live. mostly because, we had to dissect the process and dissect the, how things worked. And then once we understood kind of the processes, we could create solutions and then measure how well those solutions met the target or met the expectations of the client. I do really think that that is change management. We can do that in many different ways. And I love the fact that, I get to do this with technology. So that's kind of some of the work that I've done before. I was lucky enough, I had mentioned that I had found a small electronic medical record startup here in Kelowna called MedAccess. I was one of the senior leaders of that group. They actually I think they took a flyer on me. I didn't have any healthcare experience, but had this kind of bigger systems experience. And so it was quite interesting learning about kind of the primary care processes, how to kind of help make things easier, dare I say, even, help in some cases automate portions of, kind of processes, which I think contributed to making workflows easier. The collection of data, just part of, it is just an easy byproduct of the process. And so I think because I've had that experience at the individual clinic level, I've also had that experience, if I could, at a group or community level. So to be able to have that experience at both in a practice and at a community has really driven the different expectations that I have, that I think that, data can really help at those different levels and different ways too.
Yeah, and through your experiences there with MedAccess, through your subsequent experiences with the HDC, you described this mentality of measuring data to measure impact. Is that a mentality that you find that others in healthcare generally share with you? Is that something that you have to actively sell? Or is it something that people already come to the table with, do you think?
Can I just say, I think in primary care for so long, there's high demand. There hasn't been a reason, well, other than, the profession's, commitment to quality. But I mean, from a demand perspective, there's, the primary care providers stay busy. So I don't necessarily think that measurement is something that has been at the forefront because, our clinicians are so focused on providing care, which I think is great. I think it is the right thing. And I will say it's only been since 2007 here in BC when EMRs were implemented and adopted that, they could even start thinking about, oh, okay, now let me think about the patients that aren't showing up. Seeing, in terms of a specific patient cohort, what is the percentage of patients who are actually adhering to the, protocol or the treatment protocol or whatever it might be? Those weren't things that they could do before. And I still think that there are clinics that don't have that habit yet because it hasn't been something that has been nurtured or supported. So for instance, we talk about, here at HDC, we've got what I call, our measures are kind of categorized. Some of the measures that we have are what I call they're process measures, and an example here is, of your patients living with diabetes, how many of them have had an A1C test taken in the last 6 months? That's just process. I mean, that's just so that the clinician can monitor or make sure everything's tickety-boo or indicate that maybe somebody might need some extra support. I don't think people were really watching or monitoring that because they never knew that the data could support them. Now, I think that, as we support practices and communities and understanding kind of what these things mean, you can now have, well, why aren't people going to the lab? Maybe it's patient education resources that are required to be able to kind of self-empower the patients to manage. So, anyways, I mean, these are the things that before anecdotally, we didn't have quantitative measures to be able to show. Now we do. And I think now it's a matter of figuring out what's the habit that we might want to have to monitor and track these things.
You're kind of alluding there to something that I've heard you describe, which is that primary care as a system has been functioning without some of the foundational supports for a long time. And I wonder when that realization first hit you.
I think part of it is we also want the system to evolve. And so what I think has happened is like our society has evolved and our healthcare system hasn't kept pace. I can order anything off of Amazon. I get a confirmation tracking number. It gets, I can see it being fulfilled. And then I get a delivery tracking, number as well. That is just kind of something that, all consumers now have become accustomed to. And yet our family physicians, when they order a lab result, a screening test, they don't have the same reconciled process that I just described when I order something off of Amazon. When they order a lab result, they print off a paper or they e-fax it to the lab. Somebody over at the lab has to, manually re-enter in the patient information. They go and do the lab result and it comes back in to the clinician's EMR, but it's not reconciled with the original order. So there's just things like this that, don't get me wrong, that was good enough back in 2007, but we just haven't kept pace with the expectations of consumers of what we experience out in, as just normal consumers. So these are the things that I think, I just hope that we can help kind of nudge these things along.
Yeah, and so this is getting into the idea of closing the loop, of having some feedback loops like the Amazon example you gave. For people that haven't thought too much about that problem, how would you describe the downstream consequences for patients and for physicians of not having these feedback loops with lab orders or radiology tests or other things? Why is that a problem?
Well, I think, the biggest one is that it's easy to fall between the cracks. There are so many things happening and so many patients that our clinicians are trying so hard to serve that I worry that, there are things that fall through the cracks. And, there's some personal experience here, in terms of a family member's health. And I'd be surprised if not all of us have had some kind of experience where, if it weren't for our own advocacy to go and confirm, hey, did that, request for screening or whatever it is, or a referral to a specialist, I haven't heard anything back. And you find out, it actually somehow didn't get put through. I think these are the real things. It may seem small. And it's one of these things too, where I sit there and I'm like, if you aren't familiar with the system, sometimes you just trust that the system is taking care of you. And sometimes it misses things. So this is where I feel like, there's some examples here that, this is what at HDC, trying to look for ways to provide some of that information back to our clinicians. We recognize the system is not perfect and that's okay. We're going to try and help and try and support kind of increasing awareness where there may be a need, making sure that we're engaging with clinicians to confirm whether or not, that might make sense. But I think it's important that our clinicians also have a greater sense of awareness of what their practice might look like by the numbers. Because often when they see the numbers, they might have their own motivation to act or to want to monitor or to dig in and get curious. And I think that is just a healthy part of having data at your fingertips.
Yeah, well said. And I think you've touched on some notes there that I think will be deeply familiar to patients and clinicians who have navigated these systems. We thought before or as EMRs were starting to roll out that that the system would be smoother, things would get taken care of naturally. I think there's a lot of patients, I will say, speaking as a clinician myself, a lot of patients who think that almost anything that's ever happened to them in the system, that I should be able to just look at it, quote unquote, in the computer. And that's sometimes true. Certainly we have some hospitals and clinics that are networked, and there's different amounts of friction depending on the situation to get that information. But I think that what they imagine and what we see in practice, there's certainly ongoing gaps, as you're mentioning. You also mention connecting with clinicians, and a few kind of questions on that topic. So you've talked about this idea of connection before content. Maybe we can just start there with kind of what that means and how that's been a part of your strategy at HDC.
We're super fortunate. The Rural Coordination Center of BC sponsored the Atleos, Sean and Heather Marie Atleo. They have started a compassionate leadership center here in BC. HDC was lucky enough to have been able to send a cohort of team members, clinicians, part of our HDC core team, to be able to learn more from this approach. And I will say this connection before content piece is huge, I think, for us. My field team will head out and go meet clinicians, often bring them lunch and show them kind of some of what their practice looks like by the numbers. Usually the first meeting, there's a lot of hesitancy and really kind of getting into the numbers. Because I think for so long, the use of data in BC was kind of used a bit more for judgment versus kind of empowering kind of operational processes and empowering clinicians. For so long, it's been sucked up and rolled up versus kind of being ingested and then providing the insights back down. I actually love Kadar Mate, actually from IHI, had a great quote on this and spoke exactly to that. We need to start kind of bringing the data in and pushing it back down to our team members on the ground, because they're the closest ones that are providing the care to us patients. And so it's a matter of this kind of culture change, to be quite frank. I feel like the team goes in and gets to know the clinician, helps understand where their interests are, and then can go into the application to HDC Discover and show them some different areas of their practice. It's pretty common when a clinician will be like, that can't be right. And we will go through the time and do a bit of an audit with them to ensure that, hey, let's go double check this. And this is an opportunity sometimes when it is right. And it's an opportunity for reflection for the clinician. We don't push anyone to do anything. It is often our own clinicians that want to do things for the benefits of their patients. And that's what motivates the majority of our physicians and nurse practitioners here that use our application. And so, again, I'll just say this: instead of data being scary or being, deemed as inaccurate, I feel like this is where our organization works on creating a safe space for discussion around their own practice data. When that happens, wow, do we ever get some wonderful advocates, because then they can see how it helps them. And they're typically the ones that go to their community and try and, kind of promote looking at things as a community.
Yeah, so I hear this a lot of things that you're doing with the CDSC, with just physically being a presence in family physicians' clinics in a way that makes your presence a regular thing. It makes your intentions be clear as an organization that's trying to empower rather than use data for punitive reasons. And you capture this in many ways, but in one way is through your bright spots stories that you publish on your website. And these are stories about the data being used, to great effect. I'm wondering if there's any of those stories that stand out for you that might be a good illustration of how data has helped either a patient or has changed a clinician's day-to-day practice.
Yeah, you bet. I mean, goodness, we're so lucky when we get to hear these stories directly from our users. And I think we're always even more lucky when our HTC Discover users are willing to go on the record to share some of this. I think most of our primary care clinicians are quite, very humble. So to be put in the spotlight is not always something that is comfortable for them. So I will maybe share just a couple of them. One of the more recent ones was with Dr. Dodek. Actually, this is where he was inspired by a previous bright spot. We had published some of the work that our team had done with Dr. Stuckey. He's a clinician in the interior BC. And I understand Dr. Dodek had read Dr. Stuckey's Bright Spot and was like, I want to do that. Which I love it because this speaks to spread. This speaks to the utilization of, how this can be done by many and that collective impact. But I will say, Dr. Dodek, there's a quote, and I just, if I could share it, and I think it speaks to the humanity. Like the data is just data. It's our clinicians that bring the warmth and the humanity and to the situation. And if I could, there's a quote.
Yeah, of course, please do.
There's a quote that he shared with us. This project highlighted for me the profound beauty of longitudinal relationships in family medicine. While the data from my quality improvement work appears as numbers, rates, percentages, outcomes, each one represents a real person. I just felt like I got teary when I read that the first time, because this is kind of this is what for us excellence looks like.
Yeah, thank you for sharing that. It's so important for us, whether you're more of a stories person or a data person, to find ways to meld those two, because those stories really bring a lot of humanity and power to the numbers. So, thanks for sharing that. You also mentioned when we spoke before the importance of meeting physicians where they are. And I can imagine as you're talking about visiting physicians in their clinics, maybe on a busy day at lunch hour, that some of them are early adopters, excited to use data, and are already, they're on that early part of the bell curve. And there are others who might not even find themselves on the bell curve at all for a variety of reasons. And as we live in an epidemic of burnout in healthcare, I wonder how you as an organization approach people in that situation.
I think we try and reconnect with why they became a clinician in the first place. And this is where, again, I've got the team is great around this, and I'm a bit more so, I think, of a process person, which isn't exciting, right? Going in and talking about, wait, what's your process? People don't get excited about that. But people get excited about talking about like new clinical treatments that they're trying with their patients, and I anticipate that this should help them, right? And you can sit there and be like, well, what could we use as measurement to track that? Is there something that we could start, measuring to provide that feedback to you? And that's when you see people get excited. This is why I think it's so important. Like, we're one of the few organizations that is actually looking at, kind of tracking patient outcomes. Much of the other measures that we try and support as well are kind of, like I said, more process measures or capacity measures. There are a few groups, I think, right now, and we know of a number of them across Canada, but there are a few that are trying to really capture the patient impact. It's not always easy, but that's where our clinicians get excited. So that's where we want to lean into. So you're right. We have a story of clinicians where they didn't want to potentially capture certain data points, but then when they realized they couldn't kind of monitor or manage their patient panel because they had no visibility, they're willing to change because watching a few of those indicators was worthwhile. It's worth the investment. And that's kind of where we try and figure out where people are at. And I will say this, there are clinicians that full on, they need to take a break because they've been working so hard, and burnout is real. And that's okay. Sometimes, and again, I'll say this to my team, just go in there and make sure you show them the enormous contribution they're making. And maybe that's all you do. It's just to reinforce that they're doing a great job. And then once they're ready, they will ask you. And it's happened. And we're very grateful when we get that opportunity.
You've mentioned a couple times the HDC Discover, and I think this is kind of your flagship product. Can you tell us a little bit about what HDC Discover is?
Yeah, you bet. So I mentioned earlier, we're so lucky to be connected, integrated with 6 different EMR solutions. We have agreements. There's 3-way agreements, us and the clinician. The clinician has a different agreement with their EMR, and we have a separate agreement with the EMRs. So it's a 3-way relationship. Once the clinic has agreed to the agreement between us and them, data will be released, and we basically take a copy of the data and run clinical measures, basically. So we've got a slate of, I believe it's just shy of 400 different clinical measures in our system to be able to kind of provide a view of what's happening in practice. Now, like I said, when we're coming to a clinic and they're already a little bit, nervous, we're not going to show them all 400. We go and find out where they're interested. But this is where, again, we're very clear in our product to show how are these measures defined? What different codes are we looking for? What is the intention of this measure? And what are the guidelines that kind of influence the definition of this measure? And I think having that together helps the process for just, again, allowing clinicians, they're seeing this often for the first time. When they are used to a one-on-one patient encounter, it is not a habit for them to take a half step back and look at their patient population as a whole, or even groups within their patient population. So that's just the type of work and services that we provide as well to our clinicians. So there is a product, but I always want to call out my team because my team's awesome. And we also have associated services to support too.
Right. And I think a lot of people who have had any kind of measurement in their practice will kind of readily intuit some of the things that might get measured. You mentioned A1C earlier, blood pressure numbers. I think there's a lot of different metrics that might come to our minds readily. And I think we might also, clinicians listening will also intuit, how that might be useful to them as a single individual clinician. But I know that your vision also extends, and your current work extends broader than just giving feedback to an individual clinician, that you're looking at practice level. You're looking at the 37 different divisions of family practice throughout the province of BC. And then also how there's, what meaningful connections and meaningful work you can do between family physician offices and hospitals. I wonder if you can paint a bit of the landscape of what it looks like beyond the individual physician.
I think, this is evolving. And I think, what we aspire to is very much so aligned. I just recently attended an InfoWay presentation, and when InfoWay talks about like interoperability and being able to support the provider at the point of care with the right information at the right time, and also empowering patient access to their own record. Wow, these are things that I get super excited about. These are things that there's no one organization that can do this on their own. And I think that the more we talk about how data should serve the system, you'd be amazed at the amazing and creative things that come up. And I think this is the excitement. This is the piece. What might be needed in rural BC might be different than what is required in an urban community here in BC. And I think part of that is just understanding a bit more of how, what are the many different ways that we need to consider. I don't want us to get overwhelmed because it can get complicated, but we have to ensure that we are looking at this from many different angles. I say this because first of all, big shout out to our divisions of family practice that are in rural BC. They have been stretched beyond belief. And when it is common for their patient to present at a hospital outside of their jurisdiction, and there is no way that the communication gets back to that clinician in a timely manner to be able to ship the patient's record. And let's say, let me just again, international patient profile, like even just their medical profile allergies. Let's even just stop there. Like, can we not just get some of that basic information? I think that's when we're talking about like safety and care. That might not be as common for urban areas, but I know it is for our more rural locations.
And shifting kind of from the current work that you're doing into what the future might look like, both for you, for HGC, and perhaps for the province more broadly. If you imagine primary care in British Columbia with the foundational supports that you feel it truly deserves, what does that look like?
Well, that's a big question, Jason. I attended a health quality forum conference 2 years ago. A gentleman named Russell Cormack spoke at that conference, and he talked about how 80% of our healthcare spending is spent on acute care, and 20% is spent on community and primary care, give or take, right? Like ish. And it struck me. I was like, oh my gosh, it's true. But I love the fact that there's that robot doing, surgical work at the hospital. but hold on a second, right? Like that doesn't seem right. So when I talk about kind of, I'm not exactly sure what that all looks like, but I do know that we need more supports to help coordinate at the primary care level. I don't know exactly what that means. I look at our sibling organization, or across the country. There's great examples of how there are teams that are working together to be able to really improve access and quality care. I'm often inspired by a number of those teams. And I think technology is one of the things that enables that. I also believe that people actually understanding the issues at hand and being creative to find ways to improve is also very important. That they are the ones that direct the technology to do the right things. And as I mentioned before, I'm a big believer that data is the byproduct of good processes. So again, when we have a system that is working well and it's connected, and the information is getting to the right people at the right time, we'll see that reflected in the data.
Yeah, well said. And, to imagine a future in which family physicians have all the right supports, where, the funding, as you're alluding to, maybe shifts a little bit more in the preventive primary care direction. What is HDC's role in that future?
There's so many things I'd love to do to support our primary care clinicians. I recognize that today, our current capacity, I am very proud of the work that we do to support our primary care clinicians and the communities that they serve. I am so grateful that we have so many great partnerships with divisions of family practice across the province. And this is new for them too. They never ever before had access to these aggregates. And, it's new. It's a matter of figuring out, okay, so what does this mean and how can we use this? We've got a number of divisions that have, used our data to advocate for more services in their community. And I love that. I think that is something, no matter what, we continue to support that. But I do have a dream at some point that our feedback mechanism is more active, that it can support, who knows, maybe one day I might be able to stand up a service that might be connected right into, an implementation service right into the clinics, so that we get that the clinics are very busy, but when we find opportunities where we could manage processes that are, clear and that are agreed upon with the clinician, maybe we could even go ahead and engage their patients with the provider's knowledge, to be able to drive some of those kind of patient outcomes that they as well want to see. Who knows? Who knows? Jason, that's me just saying, I'd love to be able to be, but again, there's a lot of legislation, there's a lot of legal, there's a lot of all that stuff. But I just feel like we want to help the clinics more, because their patient populations are only getting more complex than before.
Yeah, and they need extra layers of support. Anyone who's experienced primary care as a clinician or as a patient, I think, sees the importance of giving as much support as we can to our truly frontline people, our family physicians and others providing primary care. I wonder, as you do this work and you think about the future, what gives you optimism right now?
You know what gives me optimism? When I ask this question and people, the light goes off. I sit there and I'll ask you, I'll ask all your listeners, who do you want to have the most comprehensive view of your health record? Who do you want to be in your corner to help navigate our healthcare system when you need it? I have optimism because I believe that we're trying to support patient medical home. And I believe that many people, when you ask that question, people stop and go, well, hold on a second. They all come to that answer. So my hope is if I can ask that question more and people come to that realization, we can all figure this out together, because there's many different ways that we can get there. But, again, and the systems are different, the people are different, but I'm certain we can find a way to get the information to the people who need it that can help us the most as patients.
I think that's such a great place to round out a conversation that I've so enjoyed and so appreciate you coming to have with me today. For listeners who'd like to follow your work or connect, what's the best way for them to do that?
Well, absolutely. Connect with me via LinkedIn. You can find me as Gayle Grout. Otherwise, love for people to visit our website at hdcbc.ca. We also have a monthly newsletter, so feel free to subscribe to that. I will say this, I love our newsletter because we like to sprinkle with lots of bright spots. And I think, there's some amazing work that's happening. So we like to make sure that we get to acknowledge and spread that too. So those would be the best ways, Jason. And I thank you so much for having me. What a great opportunity to talk about the stuff that we get to do.
Likewise. And, for anyone who does want to reach out to you, I will include all of those references in the show notes. Gayle Grout, thank you so much for all of your energy, for the beautiful things that you're doing for your province through the Health Data Coalition. And I look forward to talking with you again. Thank you so much.
Thank you.
Thanks so much for listening to today's episode of Leading Quality. If you enjoyed the show, please take a moment to like, subscribe, and share it with someone who might find it useful. You can find all our episodes at leadingquality.buzzsprout.com or in your favorite podcast app. The show was written and hosted by me, Jason Meadows, edited by Milan Milosavljevic, and produced by Thrive Healthcare Improvement. See you next time.